Hi, my name is Kristy Richards, and I'm a medical oncologist at Weill Cornell Medical College, and I also am a cancer researcher. I have a laboratory at Cornell, and we study canine lymphoma and human lymphoma, looking for similarities between the two diseases, figuring that those will be good targets for therapy. And we then use clinical trials in dogs to help study those medications, those new medications that we develop faster, and get them into humans faster. This strategy of doing this has proven fairly successful. As a matter of fact, about a year ago, I received, along with my collaborators, a grant from the Biden Moonshot Foundation to help support our work. Thank you very much. I really enjoy my life as a physician-scientist and my work as a physician-scientist because I think it helps me to see cancer from more than one angle. So I see it from the side of the clinic and patient care, and I see it from the side of laboratory research, and I think that helps me to be a better doctor and a better researcher. Also, about a year ago, I got yet a third perspective on cancer. I woke up in the morning to go round on the lymphoma patients in the hospital and found a lump in my breast. That quickly followed with a diagnosis of breast cancer, and I spent the next year, the past year, undergoing first intravenous chemotherapy, and then after that, surgery, and then after that, 5 weeks of radiation therapy every day. And then after that, 6 months of oral chemotherapy, which I will be finishing in 11 days. Not that I'm counting. And I learned so much more, even given my background, than I ever knew before about having cancer from that perspective on the other side of the stethoscope. Probably the most important thing I learned is that the amazing things that can happen when people work together and rise to the occasion. So I could not have gotten through the last year without my friends and my family and my doctors and my nurses all pulling together. I mean, they sent me Facebook messages to cheer me up. They sent me care packages. They helped me at take me to my appointments. They stayed with me when I had chemotherapy. And I really can't even say enough to thank them. I am so grateful. I think the lesson there is a more broad one, that if we're going to actually talk about curing cancer now, this push for the moonshot, we all have to work together. It takes every perspective. It takes the cancer patients, the cancer doctors, their caregivers advocating for them to go on clinical trials and try out new medications. It takes people developing screening, promoting screening. It takes the whole crew, even people who aren't personally involved with cancer. We all have to work together to get this done. And I feel very hopeful that that can actually happen. We have enough resources that we can, if we mobilize them, we can do this. And I'm very newly determined to make that happen now.